I'm going to be your nurse today.
Hi, I'm Carolyn.
Hi, Carolyn. How old are you?
I'm 19.
19. And where do you live?
1460 University Drive, Winchester, Virginia.
Very good. And are you single?
Yes.
All right. And what are you doing? What's your occupation?
Right now I'm just a student. I'm a nursing student, actually.
Oh, very cool. Why are you visiting physical therapy office today?
Well, I've had a lot of ankle problems throughout my life, so I just want to come in here and see if I am qualified to do physical therapy or if I can do something just to strengthen up my ankle a little bit.
All right, very good. Well, why don't you tell me some of your history? What's been bothering you?
In 8th grade, probably like end of 8th grade, I did gymnastics and I was just messing around in the gym after practice and I shattered my ankle. I had a tib-fib fracture. I shattered my growth plate, so I had immediate surgery for that. And I was on crutches for a couple months actually, and then after that, my ankle just was never as strong. And being young, like my doctor told me I didn't need physical therapy, so I just trusted him. And I started running cross country in high school, and I always had ankle problems. I have 2 screws in my ankle, so they always hurt, but that was just normal because I thought that pain just came along with the surgery. But when I started running in college, my freshman year, I rolled my ankle a lot. And I was training over the summer, like 2 summers ago, and I rolled my ankle really bad. So I went to like a foot therapist because they thought I had broken something, but he told me that I just had torn a bunch of ligaments. So to avoid surgery, I stopped running for a couple months and just rested my ankle. But I really want to get back into physical therapy now to see if I can strengthen my ankle and start running again and hopefully be able to run for my school like I did my freshman year.
Very good. It does sound like you could do physical therapy here, but I'm just going to ask some more detailed questions just to make sure I fully understand what happened.
Okay.
Is there anything that actually brings on the pain, or?
When I run, I think it's mostly, sometimes I'll wake up in the morning and it will just hurt, but if I have done intense like physical training the day before is when it'll hurt the next morning, but mostly when I run. It doesn't bother me unless I'm doing something.
So like a lot of pressure
Yeah.
on it? Okay. Is there anything that makes it better?
I elevate it and I ice it. I've also been taking glycosamine, which my foot and ankle doctor told me to take just to strengthen my joints a little bit. It's getting better, but it still hurts. I still don't think it's 100%, and I'm kind of scared to run on it.
Yeah, definitely. Does it swell?
Yeah, it gets really swollen, and the first time I actually did tear my ligaments, the initial tear when I rolled my ankle, it was really swollen, and that's when I knew it was something more serious than just a sprain. So it does, every time I run, it swells a little bit. It's getting better now, but I always ice it after, and I wear a brace when I run too, just to prevent swelling a little bit more.
Do you hear any like popping noises or sounds like something like?
No, it doesn't make any noises. So that's when I knew like it wasn't really a bone, but ligament problem.
Okay. Is it any particular spot in your ankle? Is it kind of just like the whole thing?
It's kind of like right here, like right below where my bone is, and it kind of like goes up my leg a little bit. Not all the way up to my knee, but the pain does radiate up too.
To like in your calf?
Yeah,
or
my
in
calf
the
area.
muscle or more in the bone?
It's more muscle, like towards the outside of my leg. I can like feel it. So.
Okay. When you're at your fullest pain, is on the scale from 1 to 10, where would it be?
I'd say about a 7. Sometimes I'll be running and I'll start crying because it hurts so bad. So that's why I've stayed away from running for a while.
So running is pretty much the only thing that really brings it on?
Yeah. I mean, it's sore all the time, but it's hurt ever since 8th grade. So I think I'm just like immune to it now. I just don't really realize it. But it gets really bad when I'm running or when I have to walk a lot and be on my feet.
Okay. Does it last like a certain amount of time? Is it once you elevate it and ice it, it gets better? Like how long do you have this severe pain?
It does help when I elevate and ice it, but I think it lasts a couple days. And if I'm running on it every day like I was for practice, it never went away. So, I mean, it stops hurting like after a couple days if I'm not doing like intense physical activity, but a couple days it's sore.
Okay. So you're thinking that it's probably like a ligament problem?
Yeah, I just want to know like if the muscles are still torn and if I can prevent surgery and do physical therapy to strengthen up the muscles around the ligaments.
Very good. Well, is there anything else? I think I have enough information. Is there anything you need to add to what we've talked about?
No, I think I'm good. Thank you.
All right, thank you. I'll send the physical therapist.
Thanks.